What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, October the 10th. I want to introduce you to Dr. Chris Link, who is with us from Integrative Medicine in Jefferson City. Good to have you here.
Paul, it's great to be here. It's always great to be with you.
You know, we were talking before we went on about integrative medicine. How long has this been around?
So integrative medicine has really been around for about 30 years. Dr. Andrew Weil, who's a physician from the University of Arizona, really thought that we needed to give more credence and emphasis on nutrition and exercise and sleep and just general lifestyle matters, because those really improve our health, and then use medications, appropriate medications when needed. And that combination is integrative medicine.
Do you think we use too much medication on a regular basis? Is that a fair question?
I think that is a fair question, Paul. And things like the treatment of diabetes and hypertension, other things, even the treatment of anxiety and depression, those things can all be improved. That doesn't mean you won't need the medications, but if a person has a regular exercise program, is eating well and is sleeping well and is really connected in their community, those sorts of things tend to not manifest so much, and you don't need the medications as much, though you might, and medications can be used appropriately and safely. So we want to really combine that. But There's no question we could use less if everybody is really into taking better care of themselves. Even like in the COVID pandemic, people that became the most ill in that situation often had underlying metabolic concerns where they were debilitated in some ways. They may have had diabetes or high blood pressure. They weren't fit. They weren't eating as well. We don't really blame that. It's a terrible virus. But nonetheless, those sorts of things make us more susceptible to those kind of illnesses, no question about it.
Now, you wanted to touch on osteoporosis today. How many people are affected by osteoporosis?
An amazing amount. Between 1 in 3 and 1 in 2 women will have an osteoporotic fracture in their lifetime. That means a fracture of their shoulder, their wrist, their hip, their pelvis, their spine. So between 1 in 3 and 1 in 2 women, and 1 in 5 men. So very, very common.
So why is it more prevalent in women than men?
It's to do in a large part because of estrogen. Women lose estrogen at the time of menopause, and when they do that, they can lose 5 to 10% of their bone density in the next 4 years. Estrogen plays a major role in calcium metabolism and in the strength of bones. And the term osteoporosis, by the way, means porotic or porous bones. So it's the bones lose not only the mineralization, the calcium, which is important, but also the protein lattice structure. And those two things are really the brick and mortar of the bones. And when we talk about treatment, it means not just calcium-containing foods, it means plenty of protein.
Plenty of protein?
You betcha, because it's really a constituent, both of the bone structure, the underlying 2x4s of the bone, but also of the muscle mass. And the muscle mass and the bone are very, very coordinated. And you need to have both of those to maintain good, healthy bones and lower the risk of falls.
And exercise is important, right?
Exercise is very important.
What does exercise do to help prevent it?
Exercise, it does so many things. But, two major things. A person that stays fit because of exercise is much less likely to fall. Somebody that's dancing and walking and hiking and doing Tai Chi.
Putting pressure on the bones, right?
Yeah, well, just being fit makes it less likely to fall. It's because when we fall is when we break bones. But by loading the bones, there's a physiology that turns on the stress of the bones. Just like we can build muscle, you can preserve and build bone with weight-bearing exercises, things like lunges and squats for the lower body, possibly with some weights, and then some resistance work with the upper body, maybe with bands or weights. Those things, 2 or 3 days a week, really makes a difference on the strength of our bones, and it's something we should be doing throughout our life, and particularly when we hit midlife.
Now, I was looking at here some of the things you have testing. DXA is safe, inexpensive, less than 10% of the radiation of a mammogram. What is DXA?
So it stands for DEXA scan, and it's an X-ray of the bone that tells us about the density of the bones. It particularly looks at the spine and the hips in adults. Tells us about the density, but it also tells us about bone quality. Mm-hmm. There's a particular new factor called TBS, or trabecular bone score, that can tell us more about the infrastructure of the bone as well.
Mm-hmm. When I'm looking here with nutrition, you got proteins and vegetables, calcium containing foods like dairy, nuts, seeds, beans, soy, salmon, and sardines. Those are good.
Those are really good. And you might remember from the last time I was here, Paul, we talked about the PURE study, which was a study on nutrition. And those key foods, vegetables and beans and lentils and nuts and fish, make a significant part to an overall very healthy diet. They also happen to be very good for bone structure.
That's good. It's just good all the way around.
All the way around.
Now, you're having a free virtual talk.
Yeah.
When will this be?
So that's going to be on October 25th at 7 p.m. And we're going to talk about the integrative approach to bone health. So we're going to talk about specific exercise and specific nutrients and supplements and screening. And we're also going to talk about a supplement you probably shouldn't use. And it's in many of the bone products out on the shelves. It's something called strontium. Strontium is a calcium-like mineral. Right below calcium in the periodic table is strontium. It's denser. So it makes bones seem denser, but they're not. And in Europe, they've actually taken strontium off the market because of things like heart attacks and blood clots. So it's widely available here in the U.S., and it's not considered safe nor significantly effective. And so I would recommend that many people, if they have a bone product at home, look for the term strontium, and if they have it, stop using it.
Strontium.
STROTIUM, I believe. NTIUM, yes.
But calcium supplements are okay.
Yeah, you betcha. Vitamin D and calcium and collagen are the three key supplements. About 500 milligrams of calcium daily. About 1,000 IUs, international units of vitamin D, not expensive, very safe. And then collagen, 10 to 20 grams. The collagen is the protein matrix that holds the bone together.
Let me ask you about the calcium, and we're almost out of time here. But if you take too much calcium, can it possibly cause kidney stones or...
The answer is yes. So when you get into the range of 1,700 milligrams of calcium a day, you can cause kidney stones or too much vitamin D, particularly if you have a predisposition for kidney stones.
Okay,
so for most people, stay in the 500 milligram range because you really need about 1,000 of calcium daily, and it's really easy to get that if you eat your standard diet and take a little bit of calcium supplementation. Don't take too much.
Chris, thank you so much. Pleasure having you on here. If people want more information, they can go to drchrislink.com to visit Dr. Link's webpage.
And please join us at the talk.
Okay, that will be October the 25th. It's been a pleasure having you on Radio Friends. Thank you so much, Chris.
Thank you so much.
Okay. Something you'd like to hear, drop me an email.